Welcome back. We're joined now by Heaton Eye Associates Dr. Jordan Spindle. Thank you so much for being here today.
Thank you for having me.
So we've got lots of questions, right? We're trying to stay young forever. We hear you, the fountain of youth. So I guess we'll start with a very common question. What's the difference between fillers and Botox?
Sure, I get that question a lot from patients that come in that don't quite know what they need or what they want, really. Botox in general is a toxin or a chemical that relaxes muscles and therefore relaxes the wrinkles. It's really good in the upper part of the face, with your forehead, in between the eyebrows where those lines develop in the crow's feet area. Filler, on the other hand, is an injectable, almost think of it like a jelly. It's really good in the lower face for the most part, and it provides volume. As we age, we kind of lose volume, things descend, we always lose to gravity as we age, and so providing extra volume to kind of reverse things really helps the reverse the aging process. Yeah,
but we hear that Botox can be used for more than just wrinkles though, right?
That's true. Many uses, and it's expanding every day, it seems like, whether it be sweating, excess sweating in the armpits, or migraines, or jaw tensing when you're sleeping, things like that. This is a great example of a lady right between the eyebrows where you can put it in, it really relaxes it. Now, your kids may know you're mad at them when you get this, but it really helps with looking more youthful.
Yeah, so then what would filler do then, as opposed
Filler, on the other hand, as opposed to this picture, this is a picture of the crow's feet that it can really relax. You can see on the after side that it just kind of gets rid of those fine lines around the crow's feet. Filler is good. It plumps up the cheeks. You can put it between the lines between the nose and the mouth are really good. Botox is good again in the forehead with those lines that raise here, but filler much more in the lower half of the face. Even lip filler, which people are a little bit scared of for the most part.
Yeah, because you see celebrities, you know, the Kylie Jenners, how big can they go?
Right.
What would you recommend, I guess?
Very conservative with filler in general, and lip filler especially. Most of the filler that you see is probably done poorly, and most of the filler that you don't see is probably done properly. And as long as you get the right professional injector, you should be able to get a good result from that that's subtle and conservative.
That's the thing. You don't want somebody to know you got something done that each one, maybe I got a lot of sleep last night type of look. So obviously these aren't very invasive. So how long do these treatments take? How long is recovery?
Another common question. Botox is a chemical. It takes a couple days to start working, usually lasts about 3 months for the average patient, so it's something you have to pretty continuously get to maintain that effect. Filler, on the other hand, is you notice right away. You can put it there in the office, we notice a difference right away. It can last longer, up to a year or something like that. So people can be candidates for both. You can get filler and Botox and use it in their different ways.
Yeah, so what's kind of the price range for these?
Botox, in certain areas, it can be a few $100s for each treatment, depending on how many areas you want and how much you need. Filler the same way. It's a little bit more costly per syringe that you buy, but again, it does last much longer.
All right, and where can people find more information about this?
They can go to heatoneye.com. We're launching a new Renew Aesthetics division to handle all our cosmetic care, and then give us a call, 903-526-0444, and happy to see anybody, no pressure, kind of low consult anytime.
All right, thank you, Dr. Spindle, for stopping by.
Thanks for having me.
All right.